Hi, Sue McCarthy Robinson, and this week I wanted to discuss an experience that I had with that really kind of was significant and kind of stood out during one of my encounters. Encountered a particularly challenging patient this week that was presented with PTSD. And, he had some co-occurring, he had a substance use disorder along with the mental health disorder. This experience stood out as it evolved, with the diagnosis of PTSD and the symptomology that I hadn't encountered before in such a multifaceted manner. Patient had a history of severe childhood trauma, which led to the development of coping mechanisms that included substance abuse. The interaction highlighted the intricate interplay between trauma, mental health, and substance abuse, deepen my understanding of how these elements can complicate the diagnosis and treatment. The impact of this case on me was profound, as it underscored the importance of the holistic approach in the role of psychiatric mental health nurse practitioner. It taught me the necessity of integrating therapeutic use of self into patient interactions, creating a safe and trusting environment, and encourage patients to be open about their experiences, and letting him know that this was no judgment zone, because he let me know that everyone judged him. This realization reinforced the value of building strong provider-patient relationships where empathy and active listening are paramount. Reflecting on this experience, I recognized both strengths and limitations in my practice. My strengths included the ability to establish rapport and communication effectively, which facilitated a more comprehensive understanding of patients' background and needs. However, I also identified a limitation in my initial hesitation to delve deeply into the patient's substance use issues, likely due to a lack of confidence in navigating such complex comorbidities. From this reflection, I learned the importance of being proactive and inquisitive and learning all aspects of patients' mental health, including potentially uncomfortable topics like substance use. In my future practice, I will apply this learning by approaching each patient's interaction with a more open and thorough inquiry into all aspects of their mental health history. This approach will not only enhance the accuracy of diagnoses, but also strengthen their therapeutic alliance, ultimately leading to more effective treatment outcomes. Additionally, this experience highlighted the significance of interdisciplinary collaboration. In discussing the case with colleagues, I gained valuable insights into different therapeutic approaches and importance of integrating pharmacological and non-pharmacological treatments. This collaboration not only broadened, my understanding of treatment options, but also underscore the value of diverse perspectives in crafting a comprehensive treatment plan. Another key insight was the recognition of my own emotional responses and biases during patient interactions. This case, involving deep-seated trauma and complex behaviors, evoked strong feelings of empathy and concern. However, I noticed a tendency to feel overwhelmed by the gravity of the patient's history and the complexity of his needs. This awareness prompted me to reflect on the importance of maintaining professional boundaries and seeking supervision when needed, to ensure that my emotional responses do not cloud clinical judgment or affect patient care. Moving forward, I intend to strengthen my ability to manage emotional responses by engaging in regular self-reflection and supervision. This will help me maintain a balanced perspective and ensure that my therapeutic use of self remains effective and professional. Moreover, I plan to continue developing my skills in addressing comorbid conditions, particularly those involving trauma and substance use, through further education and training. In summary, this week's experience has been pivotal in expanding my understanding of the PMH-NP role, particularly in dealing with complex cases involving trauma and substance use. It has reinforced the importance of comprehensive patient assessments, interdisciplinary collaboration, and ongoing self-awareness in providing high-quality care. As I move forward in my career, I will apply these insights to enhance my clinical practice and support the holistic well-being of my patients. Thank you.